If a child is 18 months old, how many words would you think, as a neurologist, the kid should be speaking?
Well, at 18 months, a child, as stated, should be walking and should have a handful of words. More importantly, they should understand. A child at 18 months can follow simple commands verbally. A child at 18 months can point to body parts with verbal cues and may even be able to say some of the body parts. So that would be the kind of interaction one would expect at 18 months.
How many words would you think would be reasonable?
There are normal kids that don't have any words at that age but understand, but I think 20 or 30 words would not be unreasonable for an 18 months.
But sometimes kids will use pointing gyration with their own type of language.
Correct. That's correct.
And that could be perfectly normal.
Perfectly normal, and they're perfectly normal 18 months that don't have any words, or may have one or two words, but understand, point, follow commands, and those children are not of concern. But again, if a child has no words whatsoever at 18 months, that's something that you would discuss with a pediatrician, not necessarily need to go to a neurologist, because it can be normal.
If multiple languages are spoken in the house, sometimes it makes it more difficult for the kid to speak English because of the fact it's hopping around the kid.
That's correct. There are two issues here that are interesting. One is some children don't have a lot of expressive language, and that can be normal. And studies have been done a long time ago in the 80s on this, and people found that those children that don't speak a lot tend to be quiet as adults. Could be smarter than everybody else, but they tend not to be talkative people. The second issue is having multiple languages, which is the neat thing about Brooklyn, in that probably half the people we see speak at least two languages at home. Sometimes we see more than that, which is confusing. In a child that doesn't have a language disability, those children can acquire both languages very normally, although may have some relative delays, especially in vocabulary and the like, up until about age 4 years. After that, there's not much in the way of a real delay. So a child that has no inherent language problems can pick up two languages quite readily, may have some mild expressive delays, but not a lot relative to children that have one language, and by age 4 should be pretty much entirely caught up.
So a lot of this is going to be based on good observation by your pediatrician, looking for expressive language in language. Is that correct?
That's correct. So you want to look at expressive language, meaning what you say, and at the younger ages, when there's not a lot of expressive language, even more importantly, the receptive language, what the kid understands.
So in other words, there's no fixed rule. Many kids will learn at different rates, but the overall picture should be looked at by your pediatrician.
I think that's right. The pediatrician should look at this first, and if there's a concern, the patient may need to be referred to a neurologist. But there's no real fixed rate, especially with expressive language, which is really all over the gamut, and one has to be very careful about using that alone.
Thank you, Dr. Pavlakis.